The age group that it affects most commonly is individuals between the ages of 15 to 24 years of age. Now, back to the Neisseria gonorrhoeae bacteria, it's a gram-negative intracellular aerobic diplococcus. Diplococcus, which means it looks like this. Di, which means two. Two cocci, two rounded coccus next to each other. That's what it looks like. Okay. Mode of transmission through sexual contact with an infected individual. It can also be transmitted through perinatal transmission. Perinatal transmission. Mainly sexual contact with an infected individual. Risk factors, okay, for acquiring gonorrhea. Okay. So, number one risk factor is multiple sexual partners. Number two is low socioeconomic status. Three, lack of using protective barriers like condoms. And four, men who have sex with men. So four important risk factors ordered from most important to the least. Clinical presentation, it's going to cause urethritis. How does urethritis present? It presents with dysuria, increased urinary frequency, and a purulent urethral discharge that usually is yellowish green in color. Purulent yellowish green discharge. This presentation of urethritis can be seen in both male and females. In males, it can also present as epididymitis, which is a unilateral scrotal pain and swelling. In females, it would cause a purulent malodorous cervical discharge, causing cervicitis. Okay. A complication that can happen in patients with cervicitis, or as a matter of fact, one of the complications that gonorrhea can cause in females is a very dangerous clinical manifestation known as pelvic inflammatory disease. Pelvic inflammatory disease is basically when the bacteria gonorrhea, when the gonorrhea affects the ovaries as well. It affects the ovaries as well, and that's a very serious presentation that requires immediate attention and immediate treatment. Good. Okay. All right. The next one is chlamydia. Okay. Chlamydia. So chlamydia is caused by Chlamydia trachomatis, which is a obligate intracellular bacteria. The mode of transmission is mainly sexual intercourse. And passage through the birth canal. So the newborn baby during childbirth, when the newborn baby eyelashes come into contact with the vaginal birth canal, that's infected with chlamydia, it can actually acquire it that way. As a matter of fact, this is the reason why chlamydia is a worldwide common cause of blindness in newborn. This is why chlamydia is a common cause of blindness in newborns. Okay? Very important. It can also be transmitted by hand to eye contact. So the chlamydia is going to cause basically infections in basically two locations, namely the genital tract and the eyes. The genital tract and the eyes. Remember, chlamydia are actually a atypical type of bacteria because they have a very unique a very unique morphology, very unique structure of their bacterial cell. And they are actually obligate intracellular pathogens, which means that they cannot make their own ATP. They cannot make their own ATP. Okay. There's actually two forms of the bacteria chlamydia. There's the reticulate body and the elementary body. The reticulate body, this is the intracellular, metabolically active, and replicating form. So remember, reticulate, R means replicates, okay? And what does this consist of, or how can this be seen under a light microscope? It basically consists of collections of reticulate bodies in the cytoplasm of the host cell that can be seen under a light microscope as what we call inclusion bodies. Inclusion bodies. The elementary body, this is the infectious form. It's the inactive infectious form. This is the part that's extracellular form, meaning it lives outside of the cell. This is the one that's outside of the cell to go and infect other nearby cells. Okay. Elementary is E infectious and E enters cell via endocytosis. Very important. Remember, we said chlamydia bacteria is a atypical bacteria because the cell wall lacks peptidoglycan, which means penicillin and beta-lactam antibiotics are ineffective. Also, because the cell wall lacks peptidoglycan, that means that we can't really stain it that well. So it's a gram stain. It stains poorly. Okay. But it's considered a gram-negative obligate intracellular bacteria. Another unique feature about the cell wall is that the cell wall has no peptoglycan, but it has murameric acid, which is an amino acid. Okay. This is why beta-lactam antibiotics are ineffective.